Press Ganey CEO Pat Ryan joins me now from the floor of the New York Stock Exchange. Nice to see you here.
Good morning. Thanks for having me.
You are ringing the opening bell. You actually have some news to celebrate, and that is an acquisition that you announced yesterday, Healthcare Performance Improvement, which you acquired yesterday for undisclosed terms. How does this fit into your company's strategy, which is really, I guess, about patient empowerment a little bit?
Yeah, that is very true. It's a great company, great team. What it does for us is you look at the patient experience, we're going through an evolution, and safety, reliability, and building high reliability networks is going to be critical. So it'll be foundational as you think of the next 5 to 10 years and building it through this transformational era for the patient experience. And really what we're trying to do as an organization is put the patient at the center of care, and safety is critical in order to do that.
So you are contacted by healthcare organizations who want surveys, who want that information to help improve their services.
We work with over 60% of the hospitals in the United States and 80% over 100 beds around the patient experience, and providing them with data analytics and insights so that they can make judgments and decisions around their operations. Our data helps them to embed in their organizations sustainable operating practices so they can deliver this high reliability experience for patients and really better clinical outcomes and safety in the end.
So since your IPO, which was just a couple of months ago, your stock is up better than 25%. We know the market's been flirting with corrections here the last couple of days. Why is this particular area the sweet spot for healthcare?
Well, if you think about, again, that we've got to transform the healthcare system, I think everyone agrees that the patient has to be at the center of care. And our information, the data that we provide our health systems with, and the services and consulting that we provide for them to help them drive that transformational improvement and that transformational cultural change is critical. So we're in a place where I think people see that it's a growth opportunity for the industry, and we lead that industry.
Well, it's a growth opportunity for you. Your last earnings report had revenue up 13%, 10% organic growth, 3% was acquired growth. Does that mean you plan to make more acquisition? How will the revenue stream change in the quarters ahead?
So we expect to continue to make acquisitions. We'll do it in a disciplined way over the years. We've talked to the market about 13 to 15% growth on the top line, and anywhere between 6 to 9% or 7 to 9% organic growth. And we would expect to do that both through developing and innovating our own internal products. We came to the market recently with a transparency product that's been received very well, and we've developed that internally. And I expect this HPI acquisition, they have over 600 health systems that they deal with. We'll integrate that into our product mix and continue to grow that business across our platform.
So healthcare has become a rather big political issue. Witness the whole situation with Obamacare. How does what's happening in Washington impact you? Do you worry about regulations? Do you worry about this next presidential race?
Well, I always worry about everything. We try to be humble and continue to stay on top of things. I think that what you're seeing in Washington is this move towards, again, patient centricity and moving away from volume to value. And I think the value movement is very important, because an engaged patient in their care will be a patient who will have a better outcome, clinical outcome, and will be more cost effective, because patients just want to be communicated with. They want to know that their provider is competent, that they can trust them, and that they'll be part of the care, and there's a pathway to health. And so I think the work that's been done to date is very solid. We'll pay close attention to it as it continues, but I think we're in a place where we can help move and transform that era to that value position.
Pat Ryan, thanks so much.
Thanks for having me.